Okay, so imagine this. You're on your morning walk, and suddenly it hits you, this excruciating pain in your legs. But here's the thing. It might not just be a pulled muscle or getting older.
Exactly. This could be a sign of something called peripheral artery disease, or PAD for short. And get this, if you have diabetes, you're 4 times more likely to experience it.
4 times. That's a lot. So today, let's do a deep dive into PAD, how it connects to diabetes, and most importantly, what you can do about it.
We've got some fascinating research we're going to unpack, and by the end, you'll have the knowledge to understand PAD and make informed decisions about your health.
Awesome. Let's get started. First things first. What exactly is PAD? I know it affects the arteries, but how would you explain it, like to someone hearing about it for the first time?
Well, one source uses this really great analogy. It says PAD is kind of like a traffic jam, but in your arteries.
A traffic jam. Okay, I can picture that.
Yeah, so basically it prevents that oxygen-rich blood from reaching your limbs.
So it's not just that the arteries are a little narrower, it's like there's an actual blockage, like a backup of cars.
Exactly. And just like that traffic jam can cause delays and frustration, this blockage can have some serious consequences for your health.
So speaking of consequences, what happens if PAD is left untreated? What are we talking about here?
Well, initially, you might just experience pain or cramping in your legs,
Hmm.
especially when you're walking, which is called claudication.
Okay, that makes sense.
But as PAD progresses, it can lead to things like chronic pain, numbness, even ulcers
Ulcers, like on your feet.
on your feet and legs, yeah. And in really severe cases, it can actually even lead to amputation.
Wow, that's really scary. It makes you realize how important it is to catch this early.
Absolutely. And that's exactly why understanding the link between PAD and diabetes is so important. Because like we mentioned, people with diabetes are at a much higher risk.
Right, you said 4 times higher. Why is that?
Well, it really boils down to how high blood sugar impacts your blood vessels over time.
Okay, I see. So is it because that high blood sugar damages the arteries, makes them more vulnerable to the blockage?
That's exactly it. It
Yeah.
damages the inner lining and makes them much more susceptible to plaque buildup. One source even compared it to, like, throwing garbage in the street. Eventually, it's going to clog things up.
That's a visual I won't soon forget. So high blood sugar is the main culprit then.
Hmm.
Are there other things going on? Why are diabetics particularly vulnerable to PADI?
Well, diabetes often comes with other risk factors too,
Like what?
like high blood pressure and high cholesterol.
Right, right.
And these things can further damage the arteries and accelerate the whole PAD process.
So you've got high blood sugar, high blood pressure, high cholesterol. What if you're a smoker on top of all that?
Then the risk just skyrockets.
Yeah.
Smoking just makes everything significantly worse.
So it sounds like having diabetes really does create this like perfect storm for KID to develop.
Yeah, unfortunately, that's true. And to make matters worse, there's also diabetic neuropathy, which is nerve damage caused by diabetes.
Right.
That can actually mask the early symptoms of PADI.
Oh, wow. So if you can't feel the pain in your legs, it could be going on without you knowing it.
Exactly. And then it just leads to more and more damage.
Sure.
That's why it's crucial to be aware of all the possible symptoms, not just the obvious ones.
Okay, so let's talk about those symptoms. What should people be looking out for? We've mentioned leg pain while walking, but are there other, maybe less obvious signs?
You're right. That classic pain or cramping while walking is called claudication. That's a key indicator.
Right.
And it usually goes away when you rest.
Yeah.
But here's where it gets interesting. Some symptoms are a lot less obvious.
Oh, really? Like what?
Things like having unusually cold feet or legs or sores that are really slow to heal,
Hmm.
or even like shiny skin on your legs and maybe slower hair and nail growth. Those could all be signs of PD.
I never would have guessed those things were connected to PAD-D.
And there's one more we should probably mention, especially for the men listening.
Okay, what's that?
Erectile dysfunction.
Really? There's a connection between PAD and erectile dysfunction.
Yeah, in some cases, PA can actually affect blood flow in the pelvic area, which can lead to ED.
Wow. I had no idea. So this is really serious stuff. We need to pay attention to those subtle signs, not just brush them off as nothing.
Absolutely. And especially for people with diabetes, we can't overstate the seriousness of untreated PAD.
Right, because we know that diabetics are already more prone to foot ulcers. Does PA make that worse?
Absolutely. PAD significantly increases the risk of developing those ulcers and serious infections, which can be really hard to treat and ultimately could lead to amputation.
It's kind of terrifying when you put it that way, but it's not just about the limbs, is it?
No, it's not.
Hmm.
PAD is often a sign of wider artery problems,
Meaning?
meaning the same thing could be happening in the arteries that are supplying your heart and your brain.
Oh, no.
This dramatically increases the risk of heart attack and stroke.
So we really are talking about a serious condition here. It's not something to ignore.
You got it.
Okay, so this is a lot to take in, but I know it's not all doom and gloom. Let's shift gears a bit and talk about diagnosis. How is PD detected? What can doctors do to identify it?
Well, the good news is diagnosing PAD is often pretty straightforward. It usually starts with a simple physical exam.
What happens during the exam?
Well, the doctor's going to check for weak pulses in your legs and feet, and they'll look for any visible signs of poor circulation.
So just kind of a visual check and feeling for a pulse, basically.
Right, and they'll also ask about your symptoms and your medical history, of course.
And if they suspect PAD based on that exam, what happens next?
They'll likely perform a test called the ankle brachial index, or ABI.
The ankle brachial index, what is that?
Well, it's a really simple test that just compares the blood pressure in your ankle to the blood pressure in your arm.
Huh, interesting. So if it's lower in the ankle, that's a sign of PA.
Exactly, because it suggests that blood flow is restricted in the legs.
So what if the ABI suggests a problem? What kind of follow-up tests might be needed?
In that case, your doctor might order an ultrasound or an imaging test called an angiogram.
An angiogram, okay. And what do those tests show?
They give a much more detailed picture of your arteries. The angiogram uses a special dye and x-rays to actually visualize the blood vessels.
So they can actually see the blockages.
Exactly.
So once PAD is diagnosed, then what? What are the options for managing it? Where do you even begin to address something like this? I imagine it kind of depends on how severe the PAD is, right? Like, what are the first steps someone with PAD might take?
You're absolutely right. It does depend. The approach is definitely going to vary depending on how advanced it is. But generally speaking, lifestyle changes are going to be that first line of defense.
Okay. So for someone with diabetes, what would those lifestyle changes look like?
Well, for someone with diabetes, the absolute cornerstone is going to be controlling blood sugar.
Right, got to keep that blood sugar in check to protect those blood vessels from further damage.
Yeah.
Makes sense. But what about people who don't have diabetes? Are there things they can do to keep their arteries healthy and maybe even prevent PAD from developing in the first place?
Yeah, that's a great question. And luckily, the answer is yes. A lot of the same principles apply. Maintaining a healthy weight through things like diet and exercise and not smoking are key. Keeping blood pressure and cholesterol under control are also really important for everyone.
Speaking of healthy habits, let's talk about the role of exercise in managing PA. I know that can be a tricky one because, well, people are experiencing pain in their legs, so it seems counterintuitive to push yourself when you're hurting.
Yeah, you're right. It can seem counterintuitive.
Yeah.
But studies actually show that even moderate exercise can really improve those symptoms.
Really? Even if you're already experiencing pain.
Yeah, think of it like training for a marathon. Even if your marathon is just walking to the mailbox without pain,
Okay, I like that.
It's all about kind of building up that artery strength over time.
So it's not about pushing yourself to the point of pain. It's about finding a level of activity that you can comfortably sustain and then gradually increase that over time.
Exactly. And as always, you should talk to your doctor before starting any new exercise program, especially if you have PA.
Right, of course. Always consult with your doctor. They can help you create a plan that's both safe and effective. Okay, and we can't talk about healthy habits without talking about diet. What role does diet play in preventing and managing PA?
A heart-healthy diet is so important for everyone,
Yeah, for sure.
but it's even more crucial for people with PA. We're talking about, focusing on those whole grains, fruits and vegetables, lean proteins, and healthy fats, while also limiting things like processed foods, sugary drinks, and excessive salt.
So that's diet and exercise. Those are the lifestyle changes. But what about medical interventions? Like, what can doctors do to help manage PA if those lifestyle changes aren't enough?
Well, if the lifestyle modifications aren't doing the trick, doctors might prescribe certain medications,
Okay, like what?
like statins to lower cholesterol, or medications to control blood pressure, or blood thinners.
Blood thinners, okay.
Right.
And what do those do?
They help to prevent clots from forming in the arteries. And then, in those more advanced cases we were talking about earlier, procedures like angioplasty or bypass surgery might be necessary.
Right. Angioplasty, that's the one where they insert a tiny balloon into the artery to widen it, right?
That's the one. And bypass surgery actually creates a kind of detour for blood to flow around the blockage.
Interesting. So there really is a whole range of treatment options available depending on how severe the PAD is. But let's circle back to those bonus tips for boosting circulation that we were talking about. I'm really curious to hear more about those. What stood out to you from that section?
What's fascinating is how simple yet effective some of these tips are. like staying well hydrated.
Oh, yeah, that's important for everyone.
It's crucial for good circulation because it helps to thin the blood. It's something we can all do so easily, yet we often totally forget about it.
Yeah, we do take it for granted. It's easy to forget how much our bodies need that proper hydration for everything to function properly. What else? What other tips stood out to you?
The source also mentioned wearing compression socks, especially if you sit or stand for long periods of time. They can really help.
Compression socks. Yeah, I've heard of those. But how do those work?
Well, they apply gentle pressure to your legs, which basically helps to push the blood back up towards your heart. It improves circulation and also reduces swelling.
Huh, interesting. I never really understood how they worked. That's a good tip. Anything else?
Oh yeah, another simple but super effective tip is elevating your legs. Whenever you can, try to elevate your legs.
That makes sense. Just get those legs up above your heart, right?
Exactly. That takes the pressure off the veins and makes it easier for the blood to flow back to the heart.
It's amazing to me how these really simple little actions can make a difference. Are there any other tips that stood out to you?
Yes, definitely. The source really emphasized regular checkups with your doctor.
Right, of course.
This is especially important if you have diabetes or other risk factors for PD,
Sure.
because early detection is absolutely key when it comes to managing this condition.
So regular checkups are a must, even if you feel fine. It's all about being proactive and catching those potential problems before they turn into bigger issues.
You got it.
Yeah.
And of
Yeah.
course, if you smoke, quitting is absolutely essential.
Absolutely.
Smoking is one of the most significant risk factors for PD,
Right.
and quitting can have a dramatic impact on your health.
This has been such a fascinating conversation. We've learned so much about PD, its causes, its symptoms, and even steps we can take to manage and prevent it.
Yeah, a true deep dive.
It really is. I can only imagine how overwhelming it must feel to be diagnosed with PD. It's a lot to take in, for sure.
Oh, absolutely. It could definitely feel daunting at first. It kind of makes you face your vulnerability, which can be tough.
So where can people turn for support? What can they do to cope with all those feelings that come with a PT diagnosis?
Well, connecting with others is always so helpful. People who understand what you're going through, you know.
Yeah, for sure.
Support groups can be great, whether they're online or in person.
Support groups, okay.
It gives you a safe space to talk about your experiences, share tips, and just find some strength in knowing you're not alone.
I can see how valuable that would be, sharing those experiences and learning from others. Are there any specific resources or support groups that you recommend?
Oh yeah, definitely. The American Diabetes Association is a great place to start. They have a ton of information on PAD and how it connects to diabetes.
Okay, and what kind of information do they have?
Well, they have tips for managing the condition, and they can help you find support groups.
Right, makes sense. What about online resources? Are there any websites that people can trust?
Yeah, for sure. The Vascular Disease Foundation and the National Heart, Lung, and Blood Institute both have really good info on PAD.
Okay, what kind of info?
They have the latest research, different treatment options, and lifestyle recommendations. All kinds of stuff.
That's great. We'll include links to all of those resources in our show notes so everyone can check them out. And of course, let's not forget about talking to your doctor.
Right, don't underestimate the power of just talking to your doctor.
Absolutely.
They can answer your questions, address any concerns you have, and even refer you to a specialist if you need one.
So it's a real team effort. Your doctor is there to support you and guide you, but ultimately it comes down to taking ownership of your own health.
Exactly. Every step you take towards a healthier lifestyle is a victory. Remember, knowledge is power, and you have the power to make a difference in your own life.
Well said. This deep dive has been so insightful. We've learned a ton about PA, its causes, its symptoms, and what we can do to manage it, even prevent it. But before we go, I want to leave our listeners with something concrete they can do. What's one small change people can make, like today, to improve their circulation and their artery health?
Ooh, that's a good question. I would say take 5 minutes today to schedule that checkup you've been putting off. Or maybe swap that sugary soda for a glass of water. Little things like that can make a big difference.
Love it. Small steps, big impact. Stay informed, everyone. Prioritize your health, and don't hesitate to reach out for support if you need it. Remember, you're not alone in this journey.
Thanks for joining us for this deep dive. We'll catch you next time.